Connolly.
An ceist a dordaí an teachta seartáil sinna Slánitecare policy a dailsí belta na 2017 nuair a bhí an tánaiste ina taoiseach ag an am, agus bhí sé lárnach sa phróisis, agus policy a tá tepi umlán ag an rialtas go háirid í bhíneise an bhirt hinseach a dairí as a cuid fust le déananig. Minister, I'm returning to the subject raised by Deputy Shorthall, and I have to say I'm reading with disbelief. The resignations were shocking enough, but the manner in which the government has dealt with those resignations, and you've come in here today and you have minimised once again and put the blame on COVID. Let me say, in addition to housing, health was the biggest issue for all of us in the last 3 elections from 11 forward. I came forward in 16 and my group sent a member to the committee and they worked cross-party and produced the report. Rather than coming in continuously complaining, highlighting the deficiencies, which I'm acutely aware of in Galway City, we went with the cross-party report, which was finally produced in May 17. There were 46 key recommendations in many areas, one of them being the rollout of a regional framework. Since then, we have 2 senior resignations and a third one from Professor McCarthy down in the southwest. What did Tom Kane say when he retired? The requirements for implementing this unprecedented programme for change are seriously lacking. We don't quite know what Laura McGahey said, because when she met with the Minister, it remained secret with the Minister, although the Minister, when he came out, is reported as saying he described the meeting as a standard meeting around issues and looking at various elements of the ongoing reform. That was the comment made in relation to his meeting with Laura McGahey. You said today that there was a meeting with Tom Kane. When did that take place? When did it take place? Are there minutes of that meeting? Because I understand that gentleman is out of the country. I come from Galway City, and many people have suffered and are suffering as a result of public-private medicine, as the failure to invest in public medicine, and this was to be the blueprint, as Deputy Shorthall said, for reform. I have repeatedly pointed out that it's unusual for doctors and consultants to write to us, but they have in Galway, to tell us the extraordinary list of a long list of people waiting, for example, the word has escaped me, in relation to bones and breakages. And I say that because I've lost my train of thought, because so much has happened in that time. 2 theatres went out of action in 2017. I understand they're now being built, orthopaedic surgery, and they're now being built now. So rather than me coming in here on a regular basis talking about trolleys and talking about long lists and letters from doctors and letters from union prior to the COVID telling us the delicate state of the health system, could you please explain to us today what you have done as a government in relation to the 2 senior resignations and the third one from Professor McCarthy in the South West?
Thank you very much, Deputy, for raising this issue as well. And Deputy, I mention COVID-19 not as an excuse, but as a reality. The reality is 5,179 people have died in Ireland with COVID-19. That is a reality. There have been points over the last 18 months when our system was under real strain, and we got through that thanks to the heroic work of our frontline workers in the HSE and allied health professionals and others working across the system. But despite that extraordinary strain, which is, we hope, a once-in-a-century level of strain that any health system would have to withstand, we have made real progress. We have, when you look at the report that Laura McGahey herself brought forward, the implementation update in respect of Slánitecare, of the 112 deliverables for the first 6 months, 84 were on track, 25 were being progressed with minor challenges, and 3 are experiencing significant challenges. So that's 97% of those actions either delivered or are on track. And in the context of what we have had to live with and what our system has had to coexist with and grapple with over the last 18 months, I think that is a remarkable achievement. And when I look at the once-in-a-generation increase in the capacity of our health system, with the sanction provided for well over 1,000 additional beds in our acute hospital system. Now, we don't have 20 or 30,000 beds, we have in the region of 11,000 beds. That is a dramatic increase, and a step change that we have made in respect of critical care capacity as well. And of course, the learnings of COVID have been relevant, because we are going to have to future-proof our system for events like this that could well arise again into the future. So the government is absolutely committed to this transformation of our public health system. It is not going to be easy. There will be challenges along the way. And of course, we have to assess the reasons why these resignations took place. And that is why the Minister has had direct discussions with Laura McGahey and with Professor Tom Keane, and has met with the Slánitecare Implementation Advisory Council. And in the forthcoming budget, you will see a further manifestation of this government's commitment to delivering on those reforms. Change isn't easy, but it's certainly not easy when you're living with a global pandemic that has taken over 5,000 lives in this country. But our commitment is resolute, and our commitment will be brought to bear and implemented through the decisions that we make, working with all of the stakeholders across the health system.
Thank you, Minister. Deputy.
No COVID in 2017. When the report was launched, it was because it was urgent and necessary. When did the Minister meet with Tom Keane? Can you please clarify that? When did that happen? In relation to the rollout of this programme, COVID, I hope I never hear a Minister stand up here again and use the deaths of people from COVID as an explanation for why there was no progress, as there was no progress in relation to the implementation of a plan that was necessary because of the deaths and illnesses of people who are suffering as a result of a completely dysfunctional health system. That's what we're looking at here. I'm looking at Galway City and 2 orthopaedic operating theatres out of operation since 17. The regionalisation is necessary, although we've gone through the dance before of the circular health boards, abandon them, bring in a health executive, have a board, abolish the board, bring the board back, and now we go back again to regionalisation. COVID did not stop regionalisation, a lack of willpower. I'll finish, Minister Cancurla, by saying it should be located within the Department of the Taoiseach. Where is the Interdepartmental Committee with oversight? Where are the minutes of that? How often did they meet? Who's pushing this, notwithstanding that we have to deal with COVID as a country?
Minister.
Thank you, Deputy. Minister Donnelly spoke with Professor Keane over the phone, because Professor Keane is in Toronto, and he spoke on more than one occasion with Laura McGahey since her resignation took place as well. And as I said a number of times earlier on, he has spoken and met with the Implementation Advisory Council and will now consider their request for an extension of time. But we'll consider that in the context of the consideration of what we need to do to strengthen the governance arrangements in respect of Slánitecare implementation. Because we are absolutely determined to get this right and to ensure that that governance is as strong as it needs to be, and that any obstacles and any roadblocks that are there within the system, because they're not at a political level, that they are removed. And that is the commitment of this government. We're providing the resources. Why would you think that we do not want to implement this? We absolutely do, and I think the increase in the capacity that we've provided in our system lays a very solid foundation for those reforms, because that has been, I believe, the single biggest weakness in our system over the last couple of decades, has been that lack of capacity. That had to be fixed first, and we're now well on the way to fixing that, and we'll make further progress across 2022.
Thank you very much.